Leading the way when it comes to innovative digital care delivery models, it's something OSF OnCall has been working on for years and recently got the chance to show off its work on a national level.
If we can think it, if we can dream it, I have full confidence in the OSF HealthCare and OSF OnCall team that we can deliver it, and then add the support of the ATA from a policy, from a regulatory, from a peer support network. Sky's the limit.
That's Jennifer Junis, Senior Vice President of OSF OnCall Digital Health, and I'm Shelli Dankoff, your host for OSF HealthCare Accelerated. We appreciate you tuning in and remind you to be sure to subscribe, rate, and review wherever you get your podcast. In early May, OSF OnCall and OSF Innovation represented OSF HealthCare at the American Telemedicine Association's National Conference. OSF was invited as an exhibitor to demonstrate our innovative and cutting-edge digital care delivery models. Joining me to talk about the opportunity and the possibilities in the wake of the ATA are Jennifer Junis, Senior Vice President of OSF OnCall Digital Health, and Mond Johnson, the CEO of the American Telemedicine Association. Welcome to both of you, and I'm going to start with you. Tell me what the American Telemedicine Association is.
Well, first of all, thank you. And it's really an honor to be on this with Jennifer and talk about what you all are doing and what that means in the context of the industry. So thank you for the opportunity. The ATA is the only organization completely focused on advancing telehealth, and we've created a broad and inclusive community of telehealth stakeholders. All of our members are committed to the vision that people should get care where and when they need it. And broadly speaking, we're a platform, a nexus, if you will, for creating evidence, building trust in healthcare and telehealth, and leveraging telehealth to help eliminate disparities in healthcare. We're working to advance telehealth so that everyone has access to safe, affordable, and appropriate care when and where they need it, enabling the system to do more good for more people. And our member network really is comprised of leading healthcare delivery systems like OSF, academic medical centers, technology solution providers, as well as payers, as well as partner organizations and alliances. Our goal is really to advance industry adoption of telehealth, promote responsible policy, advocate for government and market normalization through our affiliate organization, ATA Action, and provide education and resources to help integrate virtual care into emerging value-based delivery models.
Wow, that's just a lot. And that's impressive because it is the wave of the future, isn't it?
It certainly is. And it's a requirement, really, because we aren't able to reach everyone with the resources we have currently. And so we talk a lot about reimagining care using telehealth or using technology writ large. And that's why I'm so excited to be on this with Jennifer.
So OSF was invited to exhibit at ATA this year and showcase the way that we are using technology to your point, to deliver care virtually to our patients. So Jennifer, what did the opportunity mean for OSF HealthCare from your perspective?
For me, it was really about the recognition of the investment that our sisters have made. Really thinking about the way that we have approached really the structure and the infrastructure of building a digital health entity OnCall within the OSF HealthCare system. So it was a way to really have a physical presence and really show people, because we've been very fortunate to be members of the ATA for over 10 years. Honestly, when we were just starting to dabble in this space. But really now that we have put structure and infrastructure around telehealth over the last 5 years, really being able to showcase that. We talk about it, we've been asked to speak, but someone being able to walk through our booth and physically interact with us and interact with the technology and see our patients receiving care through those transformational ways was really a great opportunity.
So let's talk a little bit about the booth. You described to me how you walked into the big, the exhibit hall, and here was the signage, here was everything. But let's talk about what was in that booth. What hands-on things did the people who were attending get to see?
So we really tried to replicate the Digital Health Center building OnCall right down the street from our ministry headquarters. So when you first came into the booth, there was a command center. So it was a desk with a chair, trying to replicate one of our mission partners, one of our clinicians that would be sitting in the command center, really monitoring multiple programs. So we had a 10-foot by 10-foot screen that was really playing videos from our 6 programs that we were highlighting. Then you could walk around the edge of it and really have a vignette of that program. So we had a crib and a little nursery set up for our pregnancy and postpartum. We had a living room for our digital hospital to replicate that. We had a hospital bed to really demonstrate those products that go into the hospital, like virtual nursing, telehospice, ICU. And then we had another really kind of recliner setting showing how patients can care for themselves at home through remote patient monitoring. And then if you walked around the outside of the booth, you really saw the story of innovation and the innovation that has been built within OSF HealthCare that really allowed OnCall to really be born out of innovation.
And I'll ask you to weigh in on this one. So when you walked into the exhibit hall, because I saw the process very superficially and multiple iterations, and it looked on paper, two-dimensional to me, that it was going to be very impressive. When you walked into the exhibit hall and when you saw that, what went through your mind?
Well, it was incredibly exciting because I've known OSF and I've known the work that Jennifer and Dr. Vaz have done for a long time. And so to bring it to our broader audience and to demonstrate how real virtual care is, and even the whole notion of different vignettes, as Jennifer said, is really, it was incredibly powerful. So if you think of us as a platform and the nexus, the convening as a way of bringing together digital health and allowing people to learn from each other and collaborate, it was so visibly obvious what's happening in the industry and how OSF is really out there leading the charge.
So Jennifer, back to you. What kinds of questions, what kinds of interests? So the people who did come to the booth, what were they saying and what were they asking?
It was really interesting because we had such a wide variety. So we had other vendors because a lot of the early, when we first set up, it was just vendors. So it wasn't open to all the conference attendees yet. So we had a lot of vendors that came over and started asking questions, and a lot of kind of deeper technology questions about what kind of technology we're using. And then we had just a wide variety. We had leaders from health systems, leaders from private physician groups. We had payers. We had a really great conversation with a healthcare attorney that was really interested. She works more on the compliance legal side. So really, but had a baby 5 months ago. So the crib kind of drew her in. And she's like, this is amazing. Like, I wish I had this when I was pregnant with my daughter, to have that support, that digital wraparound from that virtual care team.
Interesting. So you also presented at some of the sessions. We were able to be showcased, which is always an honor to be able to be showcased. What were the topics that OSF OnCall and Digital Health was presenting and a part of?
Yeah, so Ann and the ATA asked us to do a system spotlight. So that was a great honor. That really was a recognition of the work that we're doing and that it is interesting to people. It was great because Dr. Vaz and I got to take about 20 minutes to tell our story. It was kind of like a little bit of an extension of a TED Talk. So we started with our sisters' mission and their innovation from being exiled from Germany and starting the first hospital here in Peoria, right on Adams Street. And then we got to tell kind of the evolution of innovation as well as OnCall, and then really wrapped it up with that this really takes us back to our sisters' mission of caring for patients, communities where they're at, and which is the mission of the ATA as well. Mm-hmm. And then it allowed then about 20 minutes for members of the audience to come out and have a deeper level conversation with Dr. Bosnellik and I.
So when people came to the booth after you did the presentation, what were they asking?
Yeah, so after the system spotlight, that 20 minutes, then they had 20 minutes to ask us more detailed questions. So we had questions about, is this a separate legal entity within your health system? How do you do the technology workflows? How is it connected into your electronic health record? How are your providers responding to this? What's the change management that you had to go through? So it was really detailed questions, and it was a great opportunity to help other health systems, which then benefit all of the patients across the nation.
Yeah, did that give you a bit of a flashback? Because we've been living in this. And so I'm sure somebody was like, oh yeah, we had to work through that once upon a time. And so to hear those questions kind of had to be a little refreshing, if you will.
Yeah, it's always great to take time to pause. We get very nose down. Over the last 5 years, we've been very focused in building, and expanding and growing and serving more patients through digital and virtual care. And so it was a great time for all of our team really to pause, celebrate where we've been, and then really look to the future of where we want to continue to go.
And from the ATA's perspective, is that some of why you wanted a system like OSF HealthCare to be involved? Was that very point to show to others how we can get there in this development of this system? Was that part of it?
Yeah, absolutely. It was definitely part of it. And appreciate that when you really deliver virtual care, Jennifer touched on this. This is change management. So it's not just the technology that people are grappling with and that they have to learn how to use and incorporate in their workflow, but it's change management. And that sometimes can be even harder than the technology. So it was great to have, the folks from OSF talk through that with everyone who came by the booth, which was packed the whole time I saw it. So.
Nice. So you've been associated with healthcare for many years. Why is the work of the ATA and others so important for patients and what you're doing on a daily basis?
Well, because OSF demonstrates how it can be done and that it can be done. And so that is really important. My entire career has been focused on using resources like healthcare data, digital mobile apps, technology to help consumers, patients navigate the healthcare system more effectively. And OSF is part of that by meeting people where they are, which is really what we're trying to do as an industry.
So I'm going to ask you, what lies ahead? What are the big things that we should be looking forward to coming down the pike?
Well, we have a big challenge this year in what we're calling the telehealth Super Bowl. Many of the flexibilities that were put in place during the pandemic are set to expire on December 31st of this year, which would leave millions of Americans without desperately needed access to quality care. So our affiliated trade organization, ATA Action, is leading our initiatives on both the federal and the state levels to ensure that telehealth access is not abruptly ended and that ultimately telehealth, remote monitoring, AI, that these components that allow OSF OnCall and OSF generally to deliver the services they do, that it becomes a permanent modality in healthcare.
So I don't have to ask you the question of what challenges there are because you just addressed it. We have to get the lawmakers, the people who signed the pieces of paper to say, no, keep doing what you're doing. But what excites you most about what is coming down the road?
Well, I think the thing that excites me the most is that we have the growing sense and the growing commitment to getting this done across the country, that it can be done. And I think that's very exciting. The other is that we're seeing an increasing body of evidence that telehealth can be used to improve access, reduce costs, improve outcomes, that it can be used to eliminate disparities, inequities that have been existent for a long time, that it can be used in very impactful and creative ways to reach people where they are in rural communities, in urban communities. So I'm excited about the momentum, and that's really what keeps me going.
So I'll turn to Jennifer now. What lies, because it touches on the point that Ann just made. OSF HealthCare about half of the people we serve live in these rural communities, and the whole access issue is a huge issue. Is that some of the work coming up for OSF OnCall Digital Health is, to Ann's point, making sure they get the care, they have access to the care? Is that what's coming down the road for us?
Yeah, I think in the next 3 years, really the projection for OSF OnCall is to further integrate into our health system. We have spent a lot of time building our programs, building the services, and now spreading, scaling, continuing to integrate them into our care delivery models, especially in our rural areas, but our urban areas are as important as well. And to Ann's point, equity is really important as well. And that's really our work that lays ahead. And I think Ann touched on it, and I touched on it earlier. Some of that's the change management, right? I call it transformation. Now we're on our transformation journey. We've been somewhat running in parallel to our traditional healthcare system, and now we have to bring those pieces together and completely transform the way we deliver care. And in the rural area, it's imperative because there is no access. It's gone. It's dwindling. I've spent almost my entire career prior to this working in rural healthcare and begging for clinicians to come provide care in those settings. And now we have an ability to do that through technology, through people, through processes, to really scale that and get that same high quality care in the most remote locations.
But you're right, change is hard. And
change is hard.
People want what they want, and we have to help them along the process. So is that the biggest challenge that's coming from where you see, is just having people understand and acknowledging that change is hard, but having them understand the need for it?
Yeah, I think we're better positioned now than we've ever been. I think to Ann's point, a lot of us have been doing this over the last 5 years through a global pandemic. And then now we've really proven that it is a great way to care for patients. It does produce high quality outcomes. It can be integrated into our electronic health record, so it's visible and transparent. Patients will engage with us. There was a big belief bias that patients won't engage digitally and virtually. And so now we have the numbers, the data to really show that. So I think we're in a better place now than we've ever been for that change to happen.
Is that what excites you as well on a daily basis?
Yes, and all of the new possibilities. There are so many new things that we can be doing. We showcased some of our more mature products and services at the ATA. We would be able to do 5 more next year that are in the works or are starting to be more mature. So I think that just the constant evolution and growth, if we can think it, if we can dream it, I have full confidence in the OSF HealthCare and OSF OnCall team that we can deliver it, and then add the support of the ATA from a policy, from a regulatory, from a peer support network. Sky's the limit.
Yeah.
And final words?
I would just say that the other issue that we're in lockstep with OSF on is the whole opportunity and obligation to address trust in healthcare. And so that is a commitment that we have to abide by. We have to really focus on how we're going to make sure that people have and regain trust in institutions that perhaps that's diminished over the past several years.
All right. Well, Ann Mond Johnson, Jennifer Junis, wonderful conversation. And so then next year after ATA, we'll have this conversation again.
Amen.
And see how much further down the road we are.
Yeah.
Thank you for joining us.
Thank you.
And thank you for joining us for this edition of OSF Healthcare Accelerated.